Good morning. Thanks so much for tuning in this morning. Toward the end of last week and this past weekend, we saw several instances where we reached a new daily high in positive cases. I've invited some of our state's top public health experts to join us today to share what we're seeing from this increase in cases, where they might be coming from, and lessons learned. So I'll turn it over to Jim Murphy, who's the head of the Communicable Diseases Bureau, and Stacey Anderson, lead epidemiologist, to be followed by Dr. Holzman, the state's chief medical officer.
Thank you, Governor. So what our plan was to do was provide some recent updates about what we've seen with COVID cases and trends in Montana over the last few weeks, and talk a little bit about prevention steps. To date, Montana has reported approximately 10,700 COVID-19 cases. These cases include about 600 hospitalizations, including 100 people who are currently hospitalized across the state. And unfortunately, more than 160 deaths have been reported in Montana since COVID tracking began. In June, we began to see significant increases of COVID cases when we look at the weekly totals. That trend continued from early June to mid-July, and then we had some stabilization. So from mid-July to early September, our weekly number of cases stabilized. Unfortunately, that stability was at about 800 per week. So just over the 2 months where we were stable, Montana added about 70% of the 10,000 cases that we've experienced. So fairly rapid growth. After this stabilization, though, last week showed a remarkable increase in cases. So we actually had an increase of 490 cases last week over the week prior, which brought us to 1,249 cases last week alone. So an all-time high. With that increase, we wanted to kind of look at it a little bit closer. And when you look at what counties had increases, 19 of 56 counties in Montana had an increase in cases. 6 of them had what we would consider significant increases in cases. Those 6 had 75% of that almost 500 increase. And those include Deer Lodge County, Rosebud and Northern Cheyenne, Flathead County, Roosevelt, Fort Peck area, Missoula, and Yellowstone counties. The increases in all of these areas were significant. For example, Deer Lodge's increase was 24 cases over what they reported the week prior. In Yellowstone County, they were 125 cases over what they reported the week prior. So pretty dramatic impact, and we can pretty much figure out where these cases came from. Now, local public health partners and our clinical partners are responding to these cases by emphasizing testing of close contacts, which is the policy in Montana to test close contacts to COVID cases. They're also prioritizing contact tracing. Sometimes that means their data gets to us in a few days instead of right away, because their priorities are to break the chain of transmission locally. Fortunately, right now we are able to respond to the testing demands. The State Public Health Lab is performing great, as are our partners. Over 3,000 tests hit the Montana Public Health Lab every day. At that rate, we're able to keep up. To date, we have about 315,000 tests that have been performed in Montana. So our testing rate is pretty good. Turnaround time has also been maintained. Once that test enters the lab system in Montana, we'll have a result back to the person in 1 to 3 days. That's in about 95% of the cases. A few may take longer to resolve than others, but the turnaround time has been very good lately. Our latest EPI report, which hopefully you're all familiar with, has been posted to the DPHHS website this morning. And this provides a little bit more detail on what we're seeing as far as trends from the beginning of the COVID outbreak to present. With that, I want to turn it over to Stacey Anderson, our lead epidemiologist, who is going to go into a little bit more detail about where we're seeing some of the increases in Montana, especially over the last week with the impact of school cases and sporting events, things like that. It gives us something to look at. So I'll turn it over to Stacey.
Thank you, Jim, and thank you, Governor Bullock. So again, as Jim mentioned, we definitely had an uptick in cases over the last week, and so I wanted to tell you a little bit about what it entailed, what the story is behind those cases. When you look at age groups, we saw an increase in all age groups across Montana, but we happen to see significant increases in certain age groups. And we can connect that back to a few things. So the first thing I'm going to talk about is schools opening. You know, I think we all know that when schools opened, we expected to see some cases associated with that activity. As of Friday, we have 62 schools in Montana that have reported COVID cases in their school. And this includes all levels of schools and universities. And then when you look at some of our local public health investigations related to these cases, we're finding that there's some individuals who are attending social events, for example, or things like that. And when we look at data from 2 weeks ago, so the week ending the 4th of September, and the number of cases reported that week versus the number of cases reported week ending last Friday, when you look at the school-aged group, which is generally considered to be below 19, we saw an over 90% increase in cases reported in those 2 weeks when you compare them. And so this backs up, you know, what we're saying is that we're seeing some cases attributed to schools reopening. Also, we're seeing connections to certain social events. We have case investigations. Again, our local public health folks are working really hard to do contact tracing, and they're finding that some of these cases have attended social events, whether it be associated with parties or gatherings with family, or going to bars and having social activities there. And we can back that up with data too. Not only to date can we say that 40% of our COVID cases across Montana have been attributed or are in that age group of 20 to 39 years of age. Again, when you look at 2 weeks worth of data, you look at week ending the 4th of September versus the week ending the 18th of September, we saw about a 50% increase in cases in that age group as well. So the other setting that we're finding we're having an increase in cases attributed to is, of course, congregate settings. We've already talked about schools. Schools can be considered a congregate setting. But we also continue to see cases in our long-term care facilities and our assisted living facilities, which of course is where a lot of our most vulnerable Montanans are. Cases are in both residents of these facilities as well as staff members. We're also seeing continued transmission in correctional facilities. So these are the congregate settings that have the highest number of cases attributed. So that's sort of the trends that we're seeing in the last week. And really, you know, this is where I want to talk to you a little bit about prevention. Until we have an effective vaccine or a treatment for COVID, until that's available, the best ways that you can protect yourself and protect the people around you is the things we've been talking about all along. To practice social distancing. Try to maintain that 6 feet of distance between each other. When you can't do that, wear a mask. And wear a mask means wear a mask correctly. It goes over your nose. If you're sick, please stay home until we can rule out that you don't have COVID, if you can. Try to avoid others around you who are sick. Wash your hands frequently. Clean and sanitize things in your house, in your workplaces more frequently than you would. These things will help us not only to keep COVID from spreading and having this increase in cases, but it also will help us as we move into cold and flu season this fall and winter. We're all in this together. And with that, I'm going to turn this over to Dr. Holzman.
Thank you, Stacey, Jim, Governor Bullock, and I also want to take a moment again to thank all our frontline public health workers and medical workers that are on the job dealing with this every day. doing the best they can with the information that we have with their community and the individuals in their hearts. I think it's really important for us to look at the epidemiological data because it tells us a lot of where we have been and gives us some understanding of where we might go, and thus allow us to put together some strategic planning to help prevent disease, prevent undue suffering, and to prevent even death. We have a unique opportunity here in Montana by our location and by learning from others around us. It's not only what has happened in Montana, but it's learning from what's happened in Seattle and New York City. It's learning what's happened in Florida and throughout the Southeast and now in the West. It's learning what's happened in metropolitan areas and in rural areas. While we still don't know a lot about COVID-19 or the coronavirus, we have learned a lot over the last 9 months. We know that most individuals who acquire COVID-19 have mild or moderate symptoms and seem to recover without problems. However, we still need more time to fully understand the long-term consequences. There's a new research that just came out that looked at inflammation that they're seeing in the heart and what the long-term effects on that or what that might mean is still areas to know more about. However, for some individuals, they have very protracted recoveries. There's some individuals that have secondary complications, and sadly, over 160 people within Montana have died. While we can state that those with underlying conditions are at higher risk to have a poorer outcome, we cannot state individually how one individual will respond to getting this virus. Will they have a bad outcome? Will they have no symptoms whatsoever? We really don't have a good understanding. For all that's going around, political spin will not stop the coronavirus. We need to continue to work together to decrease the diseases in our community. When disease rates rise, we see more suffering, we see more death. We see schools that have to close down, not necessarily because of a health mandate, because we don't have teachers to teach or students to learn. We can see businesses suffer as people are concerned about going out and acquiring the virus. Instead of going to a local shop, they might order something on Amazon. However, we do have strong science-based information. While not perfect, we know it can decrease the risk of acquiring COVID-19 significantly. And however, for the greatest success for this to happen, we all need to use our individual responsibilities to care for those around us. Stacey went through these individual points that we've said over and over again. But let's just say it again. We keep our distance. We do that for ourselves because we want to protect ourselves from getting the virus. We also do that to stop the spread to someone else. As we know, many people have the virus, can be asymptomatic or pre-symptomatic. They haven't started to show symptoms, but yet can still spread the disease. We may wear a mask because we care about those around us. And while it might have some mild protection for us individually, it's really to protect those around us. And again, you may have the disease without knowing it. We wash our hands for ourselves and for those around us. We do disinfectant of highly touched surfaces for us and those around us. And I can't state these last 2 points enough. If you have the virus, whether you have any symptoms or not, follow public health guidance. And if public health has determined you are a close contact, follow their guidance. Stay isolated, stay quarantined. If you have the virus, we know you can spread the disease. Back in August, I'm sure many of you saw the reports about COVID-19 deaths now being the third leading cause of death in the United States. That is not true here in Montana. It is only recently that the increased number of deaths have gotten into the top 10. And sadly, the number recently passed motor vehicle fatalities. An issue, motor vehicle fatalities, that has been a major public health concern for decades and still one of the top public health concerns in Montana. For decades, transportation, public health, and many others have been working to decrease premature deaths. We have had interventions put in place to protect individuals and the community. We have traffic laws, seatbelt laws, public education about impaired driving, and much, much more. This is all done to prevent deaths and undue suffering. While we all have COVID-19 fatigue, we need to continue to work together. Like any team sport, there'll be ups and downs along the way, but unless we work together, the chance of meeting our goals and preventing untimely suffering and death goes down significantly. We have seen what has happened around the country in both metropolitan areas and rural areas. We don't have to have those outcomes here in Montana. Watch your distance, wear a mask, wash your hands. For your fellow Montanans, for health, for the economy, we need to do it all for each other. Otherwise, I'm concerned we might see some of the outbreaks and the stresses on the hospitals that we've seen in Texas, Florida, and many other states around us. Thank you.
Thanks, Doc Holzman, Stacey, and Jim, and the three will be available for questions at the end of my comments. I've said it before and I'll say it again. You can't have a healthy economy without a healthy workforce. The two really do go hand in hand. Montana Department of Labor and Industry recently launched a new comparative performance dashboard that currently ranks Montana's sixth in the nation on employment performance since the pre-COVID-19 recession peak. In other words, we have the sixth fastest job recovery in our country. The data tracks state comparisons on a whole variety of metrics in addition to country and industry comparisons. You can find that website at lmi.mt.gov. It also finds that our state's job loss from the February peak to the April trough was smaller than other states, only down 11.6% compared to the national job loss of 16%. And as we announced last week, Montana's August unemployment rate is at 5.6%, well below the national average and the seventh lowest rate in the nation. Montana continues to outperform the national economy and many other states in recovery from the pandemic. And we know that the shorter duration of our stay-at-home order helped us to moderate economic losses and lead to the quicker economic recovery. I think back to when we'd stopped the spread of the virus, allowing us to enter a new normal and allowing businesses to again welcome patrons inside their doors. Montanans showed their resilience in coming together to fight this virus last spring and early summer. Once you all receive the case count from yesterday, you'll see that once again, we've reached north of 260 cases in a day. A number that is uncomforting and a trend that we cannot continue down. We need Montanans to be just as resilient as we were back in the spring and early summer, now and in the coming future. For our economic recovery to continue down the promising path that it is, we need to be. A healthy economy is truly reliant on a healthy population. And a healthy population relies on masking up, avoiding large crowds, staying home when sick, and following quarantine orders from your local health department. Ignoring public health best practices isn't some sort of act of resistance. All it does is harm our small businesses and put us further from our goals of minimizing the harm of this virus. When we act responsibly, small business owners can stay healthy and keep their doors open. When we act responsibly, Montanans not only feel safe, but are safe to continue supporting our restaurants, breweries, bookshops, and more. When we act responsibly, Montanans can stay on the job. Mom and pop shops in Montana often only have 2 employees, mom and pop. If they get COVID-19, they can't keep their business running. This ripple effect is why it's so critical we do everything in our power to keep COVID-19 manageable in Montana. When you follow public health guidelines, the ones that by very design are there to keep you as safe and healthy as possible, you're saying that you care for your community. You're saying you want your neighbors to be healthy and their businesses to succeed. Now, we still remain in the bottom 10 of states in terms of positives per capita, as we have all throughout this pandemic. But increases we've seen in cases over the past week are certainly concerning to me. It should be concerning to all Montanans, and in particular those who are living in areas of our state where the numbers just keep growing, yet public health recommendations are often disregarded. Yesterday, I received a document from the White House, and we'll put that on the website, and that was in advance of the weekly call that I participate in with the Vice President, the Coronavirus Task Force team at the national level, and our nation's governors. That document from the White House encourages that in areas of high transmission in Montana, that we should be issuing fines where there's a failure to wear a mask. Now, we do things the Montana way here, and we aren't going to start encouraging the issuing of fines. But I think the point here ought to be clear enough. We all need to do our part in wearing masks and find ways to encourage others to do the same. Something that the Vice President himself and other senior administration officials too are encouraging and echoing. I know that we can get our hands around the virus, the Montana way, by working together. We've done it before, and we can do it again. Let's do it by reinstilling that sense of care for our communities. Let's do it so we can have healthy workers to support a healthy economic recovery. We'll now open up for questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been asked to call, or you've been called on to ask a question. If your question's already answered, you can press 5* again. First phone question.
Hi, Governor Bullock. This is Maritza Giorgio from NBC Montana, and I have 2 questions. The first on masks. Regarding that document you just mentioned, is there any point where you could see changing your stance and imposing fines for not wearing masks?
Maritza, I certainly hope that, look, all of these are public health orders, so you could, but that's, the point is that this shouldn't be about fines, even if that's what the White House is encouraging. This should be about Montanans taking care of one another. I mean, as Stacey pointed out, look, we know that the spread is more significant in some communities, and we need to make sure that in those communities, indeed all across the state, that we're taking these steps to keep our businesses open, to keep our schools open, to keep our population safe and healthy. So no, there isn't, any additional steps that we're looking at taking right now, other than to encourage what we know that works. And your next question.
Okay, my next question is, I've heard several reports now of some medical professionals, including nurses in hospitals, telling their patients this is a hoax or nothing that needs to be taken seriously right here in Montana. I'm wondering, if for anybody up there, what's your reaction to hearing that? Is there anything that can be done to get people on the same page here, especially in our medical community?
Why don't I turn that over to Doc Holzman first, at least? Yeah.
First, I would love to know who those individuals are. As I stated earlier, political spin is not going to change this. And we've heard lots of comments about death certificates and how they filled out and are they correct. And I can definitely spend some time going over that at another time if that's of interest. But I can tell you in the United States, we have had way over 200,000 excess deaths. Deaths that are, that are more than we have seen in past years for the same time period. Those excess deaths started to increase in February, and we have seen that over this whole time. We can speculate, and I think many people believe that the COVID-19 deaths are probably higher than the 200,000 that is being reported right now. We have some ways to make a difference, and we know we can do that. And unless people take those steps in place, this will continue on. And it really doesn't matter who wins elections in November, one way or the other. These virus does not have a political affiliation. It will just continue on. And I hope the vaccine is around the corner. I hope it's effective and safe. And if it meets all those requirements, I will be in line along with everybody else to get it. But to sit around and wait for that and allow more people to die, more people to suffer, more people to have huge medical bills when they spend long, long times in the ICU is just not something that I'm willing to stand for, and I hope most people aren't either.
And Maurice, I guess I'd only add that certainly, I mean, you can find the one individual or the dissension when it comes to almost any issue of the day or topic, but would also underscore that I've met incredible healthcare providers, frontline nurses that go to work each and every day, not only to care for their patients and their community, but at risk to themselves, and doctors that are working every day. So, while there might be some outliers in all areas of the world, or indeed even in our state, I think the vast majority of folks both know what we need to do to get our hands around it, and the medical community, which is dealing with this directly each and every day, I hear continued both concerns about case numbers and continued encouragement and leadership from the medical community on what we all need to do to get our hands around this thing. Next phone question. What's that? Next phone question.
Morning, Governor. It's Phil Drake from the Tribune. How are you today, sir?
I'm good, Phil. How are you?
Fine, thank you. Was just wondering, I hear a lot of talk about, fear of a second wave of coronavirus, but do you think Montana is going through that now, or is that second wave still to come?
Why don't I let the experts talk first, and then I'll offer my thoughts. Jim? Doc Holzman, whatever you think.
So I guess I'll start. I think it feels like we're definitely in a second wave, but I think what we fear is that fall respiratory season will be truly what we worry about the most. As we start heading back indoors and we have people that are congregating again and we have our traditional influenza season, I think many of us fear that that's going to be the true second wave. But right now it feels like we're, kind of up to our waist in this second wave. But it could get worse if we can't change some of the things that are happening right now. We have an opportunity to act now and take measures that would not only prevent additional COVID cases, but additional influenza cases as we move into the fall. A lot of the same things that we're trying to do and promote to prevent COVID will prevent influenza. And if you imagine right now that we have medical units, like in Billings at the hospitals, that are stressed by what they're seeing right now, imagine how that's going to be in a month when our first influenza cases start rolling in. So I do think that it feels like, we see that second wave approaching, and I think that there's things we can do about it. And I'll turn it over to Greg.
I just have one other point to add on to that, and that is, besides trying to get the virus cases down now before we get into that, is also to remind everybody this is a good time to go out and get your flu vaccine. It's real important this year, as it is every year, but decrease the risk of having that infection, decrease the risk of having both diseases at the same time.
Thank you.
Yeah, I hope that answers your question, Phil. I mean, if you think back to the days where we were literally reporting 0 cases statewide, look, on the one hand, you can feel like this is the second wave, but also recognizing that it's not like this virus has ever been eradicated out of Montana or anywhere else. And all throughout, we've said, until effective treatments, we have to learn how to live with this virus in our midst. And I think both Jim and Doc Holzman underscore, if we think this is a challenging time now, that it'll become that much more challenging with influenza. So again, the actions that we take today won't even be fully recognized for even 2 weeks from now, as we're curbing that transmission. But it is important that we take those actions in anticipation of flu season. Next phone question.
Hi, this is Perrin Stein from the Bozeman Daily Chronicle. I was hoping you could explain your thoughts on the possibility of new restrictions, maybe in the counties you highlighted as having significant increases, or ways you're working with public health, local public health authorities on possibilities of new restrictions.
Yeah, well, from that, we continue to work with public health experts, and we know that we can limit the spread by actually wearing masks and social distancing, avoiding large gatherings, staying home when sick. Following those practices is exactly what will ensure that we're not taking those steps backwards. But we ought to, and I continue to support local jurisdictions that take additional measures to address issues in their communities, so that the directives that we've done at the state level have been, by and large, applicable to all areas of the state. And local communities and local counties and local public health entities can actually be more restrictive, and we'll support those measures. Next question.
Hi, Governor. This is Kayla Darish with Yellowstone Public Radio News. I have a two-part question. According to Johns Hopkins data, Montana's positivity rate remains just above that 5% threshold epidemiologists say means we're not testing enough. How do you account for this rate if, as you say, Montana has enough testing capacity? And where do we stand with community surveillance testing, specifically in those 6 counties that saw the most growth in recent weeks?
Kayla, I'll answer part of it on testing, then turn it over to Jim Murphy as far as the overall thresholds. Yeah, look, over the last 4 weeks, we did 89,000 tests in Montana. And thinking about when we were trying to hit a threshold of about even 60,000 a month, we're at 150% of that. And when it comes to sort of those community area testing, we work with any impacted area that wants to actually stand up additional testing. Over this past week, we did community testing in, I think, Park County, and we did it in, it was Northern Cheyenne or Fort Peck, and Northern Cheyenne as well. So we do have the testing capacity and capability for the larger surveillance testing. Now, part of where our increase in testing is occurring, right, is also that any time, we're testing all close contacts of a known positive. And even though I don't, the CDC said a few weeks ago that you shouldn't be doing that anymore, that doesn't make any actual health sense. So that's part of in those areas, in those communities where there's higher transmission, you're also seeing many times higher testing rates as well. Turn it over to Jim Murphy for the rest of your question.
As far as the positivity rate goes, Johns Hopkins places that at about 5% and says that if you're at about 5%, you're probably doing enough testing. If you go above that, maybe you're not doing enough testing. If you're below that, you're in better shape. Montana's current rate is about 5.6%, so just slightly above that. So we think we're doing pretty good with that. I think one thing I would say about our testing is it has been highly focused. We've been really emphasizing the testing of close contacts, which is going to make that positivity rate a little bit higher. As we work with jurisdictions like Northern Cheyenne and recently in Park County to do a little bit more community testing, we'll start to see that impact that positivity rate. And that positivity rate will decrease as we get more lower risk people in the testing pool. We do have a lot of communities out there, such as Cascade, that are always doing low levels of community testing. They're not doing the big, broad events as much, but a lot of them are offering drive-through testing, for example, where people do have the opportunity to test, even if they're not at elevated risk. So I think, the areas are moving slowly back into that mode. Everybody's very conscious about not overwhelming the testing system, because as the governor said, we've already, over the last month, have done an impressive number of tests, and that hopefully will continue. But we do watch the positivity rate close, and we'll continue to do that and try to make adjustments as we go. But right now, I think most of us are comfortable where we're at with that. We're not seeing anything frightening by that rate of 5.6.
Next question.
Hi there, this is Catherine Houghton with Kaiser Health News. I will probably have two questions for y'all, but just to start with, I'm wondering if the state is seeing local health departments reporting positives from antigen tests at this point, and if so, if you all have any idea whether that an increase to that form of testing could play into Montana's increase in known cases.
This is Jim Murphy. I guess I'll start on that. Antigen testing is something that is now entering Montana. For instance, the long-term care centers and assisted living facilities in Montana recently just received antigen test kits. So over the last few weeks, they've been kind of getting their feet wet, using these tests. We have had some positives on these tests. We do count those as cases in Montana. In many cases, we'll ask for follow-up testing with a more sensitive PCR test. In other cases, we'll let the antigen test stand for itself. That is something that I think we're going to see more of. We're aware that it's here, and we're basically building our systems to accommodate that. Right now, I do not think that that's responsible for any of the uptick in cases because they're just not in wide enough use right now. Our cases are still tend to be pretty much PCR based. However, we're going to start to probably see that change as these tests roll out.
Great, thank you. And just to confirm, was that Jim?
Yes, that was Jim.
Perfect. Great, thank you. And then just a follow-up question, Governor, for you. I'm wondering if the federal advice is to issue fines for not wearing masks in an area of high transmission rates as part of the state's public health effort to slow the spread of this disease. Why is it the Montana way not to issue those fines? If you could explain kind of your statement on that a bit more.
What my statement was to underscore is even the federal government says we need to be taking wearing masking seriously. And I think that that's, from my perspective, that we need to take this seriously. That Montanans doing so is much more important from my perspective than any local governments issuing fines.
But it seems like Montanans are not doing so is one of the points you've stated as far as high transmission, we need people wearing masks.
Yeah, and I certainly hope...
If I'm wrong on that, though, please correct me.
No, and I certainly hope we will get to the point where the social acceptance of mask wearing is much greater. And it's unfortunate that, at times this seems to be falling into either political divides or other sort of pitting folks against one another when at least it's not just governors saying that we should do this, and it's not just health experts saying that we should be wearing masks.
Thank you.
You're welcome.
Governor John Riley with Montana Television Network. This first one might actually be for some of the other people in the room. This recent increase in cases seems to be about 2 weeks after Labor Day. Is there any connection or correlation that you guys have seen with that increase in cases and that holiday event?
I can take that one, and I would say yes. Some of the cases that have been investigated definitely have links back to family gatherings or other social events that occurred around the Labor Day weekend.
Thank you. And then this question is for you, Governor. As everybody up here has been saying for months, wear masks. It's how we prevent, socially distance, wash your hands. Yet we continue to see an increase in cases. We continue to see more deaths. Why isn't right now the time to impose harsher restrictions or to take more direct action in the state?
Yeah, and Jen, I think that at the end of the day, look, this isn't just about government regulation, right? Everybody is fatigued from this. We're all tired of having a virus around. I'm so over it, I just wish the virus was. So we'll continue to listen to public health experts. We'll continue to say what are the best steps. But we solve this not by government regulation alone. We solve it by recognizing that, look, we want to keep our schools and our businesses open. And how many times I've talked to business owners across this state that they weren't shut down because of our stay-at-home order. They were shut down because they ended up with positives in their workforce. The more that we can limit community transmission, and that really is on all of us, the more our businesses will stay open. Again, thank you all very much, and talk to you next week, if not before.